Hawaii doctors have alerted the Department of Health at least 8 times about patients they thought might have coronavirus, but none of them were tested. Gina Mangieri is always investigating and explains why. Gina?
Well, the state tells me that the 8 patients flagged by doctors did not meet the definition requiring testing. And I found out we're among just a handful of U.S. states and territories that have not submitted samples to the CDC. The State Department of Health's daily update still shows no confirmed cases of COVID-19 in Hawaii. There are 61 people self-monitoring, but none in quarantine. And they say no persons under investigation. Always Investigating found out Hawaii doctors submitted 8 persons under investigation reports to the Department of Health. But the DOH spokesperson tells me after DOH evaluation and follow-up, none of these requests met the CDC case definition for a person under investigation and for testing. What might lead a doctor to go ahead and submit that form?
Coronavirus is a respiratory illness, and it has a lot of symptoms that are identical to influenza and also the common cold, except that with influenza you have a fever, and with coronavirus frequently you have a fever. So a doctor will see a patient with those symptoms and then might be concerned that this would be coronavirus.
Currently nationwide, all testing must be done by the CDC at its facility. As of Tuesday, the state still has not submitted any samples. 43 other states and territories have sent in a total 479 samples for testing, with 14 positive, 412 negative, and 53 still pending. The state of Hawaii currently instructs doctors to collect and give the state 2 specimens along with any PUI form if both exposure and illness are present. It's not yet clear how many samples were given to the state, along with those 8 PUI forms. Dr. Kalani Brady tells us a change is being made as of this week to the form and the procedure.
Dr. Park and her team at the Department of Health have developed a new, clearer direction for how to identify a person under investigation, which we call a PUI.
Why did that need to be done?
To avoid false positives and alarming follow-up by the Department of Health of cases that may have nothing to do with coronavirus.
Will this new form also require specimens?
It may, but they will probably be collected by the Department of Health.
Rather than by the doctor right there?
Correct.
I will continue to follow up on how any samples were handled, if any were sent in with those 8 PUI forms. And we're checking on whether any of those 8 are among the 61 people self-monitoring. We're told it will still be likely weeks before any in-state testing becomes possible. Gina Mangieri, KHON2 News, always investigating.